Good morning. I'm Jasmine Brooks,
I'm Amila Gazibara.
And I'm Shayna Randolph.
and we're going to present the Chinese culture. So, geographical features about China is located in the continent of Asia. It's surrounded by about 16 countries. Therefore, it's not uncommon for the different cultural practices to be intertwined. The population is huge. It is actually the fourth largest nation in the world. So, you have a large demographic of people living in a big space. The distinct language and communication. So it's hundreds of different dialects. So even if you know the primary language of your patient, it's actually important to know the dialect of which they speak. So when calling a language line, you can get that information from them or the family and just have that exact information. Because if you interpret what they're saying differently, you wouldn't be conveying what they actually want. So communication norms, avoiding eye contact. So don't be alarmed if they look down when you're speaking to them. They hear you. They're just showing you a sign of respect. Also, shy and non-confrontational. So nods or different gestures to acknowledge what you're saying may not be acknowledging that they understand what you're saying, but just that they hear you. So be careful to get them to repeat back what you say when you're speaking. The religion is three main religions. I'm going to talk a little bit about Taoism, just because it's very closely related to the Christian religion in reference to God. So in this religion, the way, so the one like God in this religion, it knows all and sees all. Therefore, it's based on your life. It's based on a relationship with Tao. So if you're doing good with Tao, if you're respecting everyone, then you'll have good fortune. You'll have good health. This is the same as Buddhism as well. This person is the Buddha is the oldest religion in China. Therefore, you'll see this religion more in your traditional Chinese. So the family structure. So the distribution of power is based on gender, age, and generation. So your older generations are going to be the most respected. Um, the male sex is the more dominant in your age, as I was saying. So the grandparent, the eldest in the room would be addressed first and would be the most one answering the questions for the client, especially if it's a female client. But traditional versus modern, that is the traditional way. A lot of times now in modern, the women are sharing equal or more equal power. Therefore, you might have them answering more, doing more than they would normally do. So the family support is very high, so it's very cohesive. So it's not unusual to see a lot of family members there for support. A lot of times they want to be included in decision making as well. So having group family meetings or not universal, but an actual cohesive decision making process. So the health and wellness part of it. So healthcare belief and practices, same-sex doctors are preferred, especially in women when you are doing intimate things as far as undressing or touching the body. The health is considered a positive balance. So yin and yang is in balance when your health is correct. So when your health, if you have an illness, that means you have an imbalance in your body. So the goal is to maintain qi. So hot and cold foods may influence that depending on the illness. Hot illnesses are cured by cold foods and vice versa. Alternative medicine is used, so things like acupuncture and cupping, as well as like alterations in your diet to actually cure yourself. So food and nutrition, fresh fruits and veggies and actually meats are preferred, so they're cooked daily. Like many Chinese are lactose intolerant, so you may see a lot of tofu and soy milk. So make sure you have that available. Consult with dietary to actually get exactly what they do and do not eat, so you won't have that problem. So pregnancy and childbirth practices. Pregnancy is considered an illness, so a lot of times you might see the pregnant women sitting or not being as active as much because it is considered an illness. Because of this, the diet actually changes. So you have a special diet. A lot of them contain soups. Different foods are avoided, such as lamb is said to cause epilepsy, and pineapple is actually said to cause miscarriages. So those foods are avoided. pregnancy disturbs that hot and balance, like I was saying. So therefore, the diet to be based on the needs of the pregnancy of what's going on. During the birth, it's usually known to remain quiet. So screaming out and yelling will not be done. So just because the patient is quiet doesn't mean that they're in pain. They're not in pain, excuse me. So just keep asking them and make sure that they're okay. Most of the time, pain medicine is not preferred, but just to have that availability, that option to do that. Showers are limited after birth. We have what's called Zao Yutzi, which is the sitting month. So after birth, you sit for a month. You're not doing any kind of physical work. And that may be a nursing implication for teaching to try to, if you can't get out of bed, do exercise in the bed to avoid DVTs and the blood pooling. The death rituals. There are a lot of common death rituals. White cloth on a doorway. The body is dust and talcum powder. So this should be known for the person who's actually cleansing the body. Therefore, you know what should and should not be done. Relatives do cry loudly as a sign if the loved one has left great fortune. So give them the space and the room to be able to grieve the proper way that they should, just to be culturally sensitive. So before this process, if it's heading that way, get all your information, do your research on that culture. Disease and high-risk behaviors. So overall, the health issues are less than Americans in Western society. Nevertheless, with the addition, like the westernization of China, is rising. So things like obesity, hypertension, those were not known health problems for the Chinese culture, but they are rising. Because of the poverty level in China, communicable diseases are actually high. So diseases such as tuberculosis, HIV/AIDS, and hepatitis should be warranted. Environmental factors, the pollution from the different plants are an issue, as well as the tobacco. So the trade of tobacco is high and uncontrolled. Therefore, public places, they do allow tobacco smoking. So it's secondhand smokable issue as well as smoking as well. So diseases like COPD, asthma, emphysema are high.
Okay, I'm gonna talk to you guys about culturally competent care. The basic concept is always to be respectful, compassionate, and honest to your patients. You should always have some basic knowledge about the culture of the patient that you're taking care of. Many Chinese still believe in traditional remedies and traditional medication and treatments. They like to include acupuncture, cupping, herbology, the theory of yin and yang. However, they're not opposed to add Western medicine for treatment. But they do view Western medicine as very harsh and very strong, so sometimes they can be non-cooperative with treatment. They also could be non-cooperative with taking pain medication because they view pain as a weakness. Chinese patients may hesitate to make direct eye contact. They may hesitate to ask questions or to voice their opinion just to not inconvenience the nurse. Give them a firm handshake and also address the patient with respect and pronounce their name right. If there is an older male in the group, always address him first before you get to any other family members. Some Chinese patients may feel uncomfortable with physical contact, so before you get to the physical assessment, always sit down with the patient and have a little bit of a small talk just to create an environment of trust. Chinese people are very hardworking people. They're very organized and well-mannered. So when you get to the health promotion education, know that the education is very important to the Chinese people, but also is tradition. Chinese tradition always puts the family and society before the individual's needs. Chinese patients may nod their head and indicate understanding and agreement even if they don't understand the information. So make sure that before you send the patient home, make sure they read back the information and explain the information to you before you send them home. Always assess the family of the patient and determine who is the decision maker in the family, so you know who to address first. When possible, when you're having discussions, try to include the entire family, because if one family member doesn't understand the information, there is a bigger chance that another one does understand the information. It is very important to be respectful to your Chinese patients. When giving birth, Chinese patients like to make it a female affair. Usually it's always just the sister or the mom or the daughter or the mother-in-law that is present at a child's birth. At funerals, the entire family is present, but it is very important that the head of the family is there. The ceremony usually takes a couple of days. The Chinese culture is a strict hierarchy, so the elders are always viewed as very important, they're very wise, they're very respected in the family. They don't like to send their elders to nursing homes. They're usually being taken care of at home by the female members of the family, such as a daughter or a daughter-in-law. As a nurse, we have to be tolerant and respectful of any culture and try our best to learn much about different cultures to be able to provide comforting and trustworthy care for our patients.
So in viewing the Chinese culture, the ethical question that was raised was how or what should the healthcare professional do if a patient of Chinese origin is resistant to quit smoking after receiving a diagnosis of chronic obstructive pulmonary disease? Before you can educate the patient, you need to assess their needs. You want to take into consideration their age and developmental level, as well as their desire and motivation to learn, as well as their healthcare beliefs and practices. When you educate the patient in regards to COPD, you want to take into account of making sure that you have the direct link of COPD and smoking. When planning care for the Chinese patient, you always want to have short-term and long-term goals. Take, for example, if a patient smokes a pack of cigarettes a day, a short-term goal would be to decrease that from a pack a day, maybe to a half a pack a day by the end of your shift. A long-term goal could be decreasing smoking from a pack a day to once a day by the time of discharge. Interventions that should be included in providing care to a Chinese patient would include formal information sessions or culturally relevant counseling sessions. Pharmacologic interventions may be deemed unsuccessful to the Chinese patient, and that is something that the nurse should take into consideration. In evaluating the patient goals and outcomes, you will want to see if they were able to meet the target goal, and if they weren't, you want to reiterate the importance of education and a direct link of smoking to COPD. You will also want to refer them to any local resources that is available for the cessation of smoking, and follow-up appointments will be beneficial for that patient as well. References are provided, and this concludes our presentation on the Chinese culture.
Thank you.
Thank you.